Well, it is now time for us to discuss a very sensitive topic, and this particular one is public health financing. The health sector in Uganda has actually gone through some hard times. When you look at the last 2 years, I think it is one that has been having budget allocations, having it as a priority, top priority. Reason being, during the COVID-19 times, it was all about the health first. The health matters were crucial during that time. But as we speak now, still health still stands as a pivotal sector in our economy today. And also, when you look at the biggest worry that we do have as a country is the fact that in most of the hospitals, we still lack some of those equipment. Most so hospitals are country. They lack laboratories, or they lack equipment in the intensive care units, or some actually run short of drugs. And also, we've seen nurses and doctors or other health experts from different hospitals going on strike because they want salary increment, or others believe that they do not get the allowances that were supposed to be allocated to them. That aside, when we look at the big topic that we have today, and joining us on set this very morning is Anne Lumbasi, a program officer, Center for Health and Human Rights Development. Many thanks for joining us this morning.
Thank you.
Good morning.
Good morning.
Good morning.
Good morning.
So we would want to know first, the viewer would want to know, I think even Rita would want to know. She's very excited to know most of the
Yes,
things.
I'm very excited about this topic, because it's going to help me understand, at least dive through what I do not know from experts like you.
So we would want to understand, what is public health financing?
So first of all, I introduce myself again. I'm Anne Lumbasi, and I work with the Center Manager for Campaigns, Partnerships and Networking. And as an organization, we really work around influencing policies within the health sector, policies that touch issues with health, because we work around the right to health, ensuring that that is realized in this country. So when we talk about health financing, it's something that we are very committed to continue pushing, especially around the budget, of course, when the finances that are allocated to the health sector. When you refer to the Abuja Declaration, where we say the country committed to contribute 15% of the national budget to the health sector, but we haven't seen that happen over the years. In fact, what we have seen is the health allocation dwindling. In 2016-2017 health budget, we saw it was 8.9. Then it came to 2021 was about 6.8. So we have seen that instead going down. We've also seen a contribution of government towards financing its own health budgets going down. We had it at 74 in 2019, 2020, and then in 2021 we've seen it gone down to 60%. So that means we are even increasing our over-reliance on partners, our donors for our health sector financing, which is a very risk move, because the health sector, I think that the health of the people drives a lot of our economy, in terms of even the national plans, development plans that we have, the Vision 2040. We're all looking at a healthy nation to be able to achieve the economic growth that we wish to have. So we haven't really realized that in terms of government making this a priority, allocating enough resources. And when we are talking about the health sector, of course, we are talking about financing the health systems, financing the Uganda blood transfusion to ensure that they are collecting enough blood. We're talking about ensuring that health workers receiving enough remuneration for them to be able to be motivated to take care of the population, but also the staffing of the health workers. We've seen, that also not being commensurate to the population, how far we have grown, and how many health workers are there in the facilities to take care of.
Sorry to cut you short here.
Yes.
But you've drawn us back to some of the budget allocations of 2017 and 18 financial year. When you look at the last 2 years with the budget allocations, have they still not been enough for the health sector?
No, it's not enough at all, because again, like as I mentioned, for this 2020, the budget framework for 2021, 2022, the allocation is almost the same as it was. There hasn't been any increase to that. And again, as you've seen in evidence, that most of the time, even the last year, the year before, these allocations, the Ministry of Health is coming back to ask for supplementary budgets. That means it's not being allocated sufficient funds. So if between the, before the financial year is done, they are requiring supplementary budgets, it's indicative that the budget is not sufficient to do what they are supposed to do or mandated to do as a health a sector.
So let's also discuss about something to do with the finance health policy as my colleague comes in, to do with how effective can this be done in a country like ours or in our health sector?
First of all, it's been said that for us as a country, we come up with very good policies. We actually give
I like
precedence
the statement
to others, yes, that we give precedent to the other East African countries to even copy from our policies. But the challenge has been in implementation of these policies. So the fact that we put down these things on paper and we're not able to follow up to implement them, to avail enough resources for these issues to be implemented, it ceases to serve the purpose as having a good policy which is not practical, it's not really being implemented. So I think that has been really the challenge. And some of the policies, of course, it takes a very long time to be even reviewed, revised, in accordance with the developments that are happening. So that, I think, has been one of the things that has lagged us behind as a country in terms of policy implementation. The policies that we have are good, but are they being implemented and followed through? That's,
Okay, and as you speak about reviews, implementation, revision of these policies, as an organization, how are you able to even evaluate? How best do you do this evaluation?
We, as an organization, have one of our strategies that we use in engaging on policy is having a legal and policy analysis. So we take these policies, analyze them, and make recommendations to government. We bring government to table. If it's ministries, a policy that falls under Ministry of Health, which most times does, or Ministry of Education, that also touches issues of health. We analyze these policies, bring together to table to the key stakeholders, the policy makers, and have conversation in terms of the gaps, in terms of the things that have now been overtaken by maybe development or so that are not exactly applicable. For instance, the recent Public Health Act, we had the amendment that was proposed. When the conversations came up, we had one of our experts to analyze it internally, and we had a meeting with the members of parliament to break it down, what those issues, the provisions that are being proposed mean, or the implication of it. So sometimes that's how we are engaging, to see that the policies, even before they are passed, or the laws even before they are passed, we are able to analyze them, see where the gaps are, and propose the model provisions that would rather be adopted. And we do this in the lens of the human rights-based approach. So looking at the human rights-based approach, are these provisions cognizant of a human rights based approach? So that's how we've been really engaging and ensuring that at least what we have on ground is in that lens, that it would solve or address the issues that it proposes to do.
And you're highlighting about gaps. If you could contextualize it for us, what are those gaps, or the major gaps you have managed to cite on, and you think government is working on, or even is there even hope of us, putting our hopes there that it's being worked on? And let us not speak about central region, Kampala, Wakiso, but we have seen challenges arising from up-country regions across from the central region. If you could highlight for us the biggest challenge or gap that is in health financing or health sector.
Yes. So first of all, I didn't mention the other strategy that we use apart from the legal and policy analysis is strategic litigation. We actually take government to court for some of these provisions and hold them accountable, or for the court to interpret for these provisions. One of the gaps that we saw, especially in terms of maternal health, was the availability of services in terms of the emergency obstetric care within health facilities. And of course, there's an obligation on government to provide basic services to, especially for emergency obstetric care for women seeking to give birth in those health facilities, expectant mothers. So we took a case to court in 2009. It was after 9 years, I think it's when we got the decision, but it was in a positive. It was positive. It's that decision. We famously call that case Petition 16, and we were tasking government to ensure that they are services given to mothers, giving expectant mothers in hospitals when they are there, ensuring that the emergency obstetric care is available and there are enough resources for them to take care of those mothers. So that's how also we've been able to do. And we've, when it comes, of course, I understand when it comes to rural or sub-region, in the areas that outside of Kampala, in fact, even services becomes more of a challenge. It's a bigger challenge. The case that the case, when you take court to case, there were stories behind it where what had happened, where in those rural areas where health worker was not present when the woman needed emergency, and needed emergency care, the doctor was not in
because
in
I
place.
also want to know some of those things that you feel need to be addressed immediately. We're actually heading into a new financial year, and there are some allocations that need to be tackled, or allocations, or there are some things that need to be tackled, and they need certain funds to be allocated to them. So if you're to look at some of those key gaps that need to be addressed before even the financial year comes ahead of us.
I think one of the things, again, like I mentioned earlier, the health, remuneration for health workers, it needs to be allocated sufficient funds, because people will not get health care if the health workers are not being paid. There was I think a video I saw on YouTube where the health workers were complaining about not being paid for 4 months, 6 months. You're not going to expect quality health care from someone who hasn't been paid for 6 months or 4 months. First of all, they will be absent because they are looking for other sources of income, so that means people are not able to access. But also issues of, also seeing stories about, issues of blood, lack of blood. The collection of blood requires a lot of funds, a lot of resources, because it is operational heavy. They have to drive these cars to, to look for this blood, so there needs to be allocation to the Uganda Blood Transfusion that is sufficient.
But do you believe with the blood? Blood donation, what have you done as an organization? Because the reports say that now we have very few Ugandans who are willing to donate blood.
Yes, we first as an organization, we've actually had a campaign, a very robust campaign around the blood collection, and also supporting the Uganda Blood Transfusion Services to see that there is blood. We've had drives that have been organized, but also in 2020 we pushed for a supplementary budget of about 20 billion to the Uganda Blood Transfusion Services. Out of that campaign, that was one of the outcomes that came from that, to say there's need, especially when it was locked down, it was very difficult for them to collect blood. They've come up with ways to motivate blood donation, or people to come and donate blood. But I think the greatest issue is also sensitization and awareness. Sometimes people are not giving or willing to donate blood because of the myths and misconceptions around blood donation. And also the greatest blood donors are really children in school. So they are, I think, have been more reliable in terms of collecting blood. So that's why I think for now we're not hearing a lot of gaps in that. So when they're back in school, we at least have, they're always willing to donate blood. So there's, of course, encouragement. And the other issue, but the other issue that the Uganda Blood Transfusion needs to ensure that this blood, once it's collected, is not misused. There is no issues of selling of blood happening, because we had a report, one of the media houses that mentioned this, to not discourage people from giving blood when these issues are taken care of. Because
they feel there is a fee attached during attainment of that blood. The story was around when people go to health service, to health centers, and they are in need of blood. Maybe as a woman is giving birth, the health worker asks for money, but blood is supposed to be free because it's given voluntarily by the citizens of Uganda. So even in hospital, it's supposed to be accessed free of charge. It's not supposed to be charged. But those errand things, I know that the Ministry of Health committed to carry out an audit, hold these health workers who are, with that vice to book, bring them to book, and ensure that the masses are not discouraged from giving blood. And you were speaking about how you take government to court.
Yes.
In what other scenarios you've given us when maternal health?
Yes, that's pretty.
Do you have limitations, or it's just maternal health?
No,
how many cases so far have you worked on that have been progressive? And if you could share with us the ones that are already in court, waiting for appeals.
Yeah, we've taken to court many cases. I may not be able to say them all, but one of them was around the costs of treatment for COVID. When you remember when COVID had just happened, how people were being billed 70 million shillings for hospital bill, 100 million for hospital bill. No Ugandan is able to afford such exorbitant prices. So we took this case to court because the dead bodies of were being held in hospitals over those bills. So we took the case to court, and we got a judgment in favor to say that Ministry of Health had to regulate these prices, and that those were exorbitant prices. We've also taken to court issues of sexuality education. When government banned sexuality education, of course, the sexuality education, this is more of primary health care. So information prevents from getting into the place where there is a burden on the healthcare system. Those teenage pregnancies we have seen, if these young people have this information, they will be able to avoid the teenage pregnancies, and therefore avoid the maternal health complications and that come when they are they have these pregnancies before they are ready to have children. So we've had those cases. We've also had these other let's say legal aid, where individual members individual members of society come and represent them in court. So those are some of the cases we've had.
So as Joram comes in, just give me in a statement, when is government assigned to go to court? When do you take government to court? Under what circumstances? Do you take government to court? Just give me a statement.
Where there's public interest, where we need for the bigger good, where there's like issues of policy interpretation of where we need interpretation of some of these policies, where we see that some the issues are in contravention with the human rights. I said that I mentioned that we work around the right to health. So in those cases we are asking government to interpret some of the issues that we see are a violation to the right to health. So where issues of human rights are involved in terms of specifically to health, where we need interpretation of these provisions.
And in case of violation.
And yes, where there's been violation, we see that there's been violation. And the strategic cases are really in public interest. So there's a public interest in these issues. We bring government to
all right.
Yeah.
And currently Parliament is debating the Public Health Amendment Act, the National Health Insurance, and the Ministry of Policy Statements for the financial year 2022-2023 in planning for the upcoming financial year budget, where health financing is part of the discussion, as should be highly prioritized in most of the discussions. Well, as we're summing up with our discussion today, can you please just give a picture to the public what you do believe this particular Parliamentary Public Health Amendment Act will solve?
For us, as an organization, we've really looked at more of the gaps that need to be addressed. I know there are some of the provisions. This is a very old law, so there are some of the provisions that are archaic or not in tandem with where we are in terms of advancement and development. There are words that are derogatory in nature, so those will be addressed. There's reference to imbeciles. There's also an issue of managing, because again, for a long time we haven't had a public health crisis like the way we had with COVID. So giving that regulation of how to manage when there's this pandemic, so it will help in that to of course, in light of where we are as a country. But we have also been looking at the gaps which this law has, that to say this should be addressed, the amendment, the proposals. For instance, the issue of penalizing people who pass on, who infect others with an infectious disease. Let's say like COVID-19 is an infectious disease. We may not be able to control how, so it may not solve to say these people should be penalized. Also the issue of forced or mandatory vaccination. We have seen from a long time vaccines being administered, but from a place of voluntary access to this, or uptake of the vaccine. So it may not be very, it may be counterproductive to impose mandatory vaccinations.
Okay.
I think that the government can use other more progressive ways to have the population vaccinated, maybe do campaigns, do awareness and campaigns and so forth to have the population vaccinated, rather than what is being proposed as mandatory vaccination. So I think that's what I would say.
Rita, any other last question for
I would wish to know, time is really not our best ally, but I would wish to know, maybe if you could share with us, under what circumstances do you succumb to government pressure when it comes to executing your mandate? In other words, are you given a leeway all through as you're doing your duties?
First of all, although we take government to court in certain cases, we think that they are our partners. We are partners. We work with them. So sometimes it may require that to take government to court, but we don't take government to court in an adversarial, say the outcome is to punish or to do, but it's actually to help the healthcare system. We have seen, like the case for petition 16 on maternal health. Those provisions, those orders are helping the Ministry of Health implement or make better the healthcare system. We've had the Minister of Health actually on one of our events saying this, she's grateful that we took this case to court because it's helping making her job easy. So at the end of the day, the results of these cases are not really to make to cripple government or whatever, to be punitive, but to really help in implementation, the health sector grow and to be more effective. So we do that, but also Again, in some cases, that's a different strategy, but also in some cases, we just dialogue. Sometimes we may not necessarily need to take government to court, but have dialogue, have conversations. We are involved in many technical working groups at Ministry of Health, where we bring these issues to table and say, address this, let's do this and that. So it's we look at them as partners at the end of the day, because even then, if you say we are advocating for policies that are progressive, the implementers are the ministries there, whatever. So we really try to work with them, even help them to, in case like members of parliament, to build their capacity on some of these issues and so forth. So we look at it more of it's partnership. It's sometimes it may need that, but the court is brought in to just really interpret and make implementation better for the healthcare system.
All right, now for just half a minute, your last remarks as we're winding up with this discussion.
Yeah, I think that the healthcare system really needs to be prioritized. We have seen with COVID-19, I think it has really shown and highlighted on the areas that need to be improved within the healthcare system. I believe that we have sufficient resources. Yes, there's not always enough in the resource envelope, but I think where there's priority given to the healthcare sector, and also good utilization of resources, because we have seen wastage here and there in terms of the resource envelope that we have. So when we know that we have a limited refund sources, we need to utilize them well. But above all, the healthcare system needs to be prioritized, because we can't have economic growth without a healthy population.
All right. And that's Anne Lumbasi for you, and she has actually been taking us through the health financing, public health financing here in Uganda. And just a quick look at most of the things is that the mere fact that the health sector is still struggling with most of up country health centers. We have a very huge challenge, and we hope that with time the government can actually address that with time. And with that, we do take a break, and we shall return with more discussions. And this time around, we're talking about the Dubai Expo.